Question 1. A client screams when presented with a task, and your response is to say, "You need to use your words," providing attention. The screaming continues to occur when tasks are presented. Based on this ABC data, what is the most likely function of the screaming? A. Escape. B. Attention. C. Access to tangibles. D. Automatic reinforcement. Answer B. Attention. This question is tricky because the screaming happens when a task is presented, antecedent often associated with escape, but the consequence described is you providing attention. You need to use your words. The outcome states the screaming continues to occur, indicating it's being reinforced. If the behavior is reinforced by getting attention from another person, the function is attention, regardless of what triggered it initially. While escape might be an initial trigger, the maintaining consequence in this scenario is attention. The behavior works to get them noticed, even if it started when faced with a task. Question 2. You are collecting data using momentary time, sampling on a client's compliance with instructions during a 15-minute session, divided into 30-second intervals. If you look up exactly at the 5-minute mark, and the client is complying with an instruction you gave at 4:50, how do you record data for that interval? A. Mark yes, compliant at the moment. B. Mark no, compliance did not last the whole interval. C. Record duration, 10 seconds of compliance. D. Record frequency, 1 instance of compliance. Answer A. Mark yes, compliant at the moment. This question tests the precise rule of momentary time sampling in a scenario. The key is checking for the behavior, compliance. Exactly at the moment the interval ends, you look up at the 5-minute mark, which is the end of an interval, and the client is complying at that exact moment. What happened earlier in the interval, the instruction at 4:50, or whether compliance lasted the whole interval? Whole interval rule doesn't matter for momentary time sampling. You only care about that specific moment. Since they were complying at the beep, you mark yes. Question 3. Your supervisor asks you to measure the rate of a client's hitting behavior. You record 12 instances of hitting during a 2-hour session. What is the rate per hour? A. 12 hits per hour. B. 24 hits per hour. C. 6 hits per hour. D. 10 hits per hour. Answer C. 6 hits per hour. This question tests your ability to calculate rate from frequency data. Rate is frequency, count, divided by time. You observed 12 hits in a 2-hour period. To find the rate per hour, you divide the total count by the number of hours. 12 hits/2 hours equals 6 hits per hour. Rate standardizes frequency data across different observation lengths. Calculating rate per unit of time helps compare behavior levels consistently. Question 4. A client's parent gives you a detailed list of concerns about behaviors occurring at home that contradict what is in the current behavior plan. They ask you to start implementing strategies for these new behaviors. What is the most appropriate response within your RBT scope? A. Inform the parent that you will collect data on the new behaviors and report it to your supervisor. B. Implement the strategies suggested by the parent, as they are the expert on their child at home. C. Tell the parent you cannot help with behaviors not in the plan and to only focus on the current goals. D. Add the new behaviors to your data sheet and assume the supervisor will see them. Answer A. Inform the parent that you will collect data on the new behaviors and report it to your supervisor. This question is tricky because it involves parent requests for behaviors not in the plan. You cannot implement strategies not approved by your supervisor, B, as that's outside your scope. Dismissing the parent's concerns, C, is unprofessional and doesn't gather necessary information. Just adding data without communication, D, isn't proactive reporting. The best response is to validate the parent's concerns. Explain you implement the current plan, but you can collect objective data, like ABC data or frequency, on these new behaviors occurring during your session time. This data will help your supervisor understand the issue and decide if the plan needs updating. You collect data, but the supervisor changes the plan. Question 5. You are teaching a client to identify pictures of animals. You present a picture of a dog and say dog. You immediately reinforce the client for saying dog. Which specific verbal behavior is your prompt? Dog, intended to evoke. A. Mand. B. Tact. C. Echoic. D. Intraverbal. Answer C. Echoic. This question asks what type of verbal response your specific vocal prompt is designed to elicit. When you say a word, dog, immediately before prompting the client to say the same word, you are providing a vocal model. The client's response of repeating your model is an echoic behavior. You are using the echoic prompt to help the client learn to say the word, which they might later use as a tact. Labeling the picture, or mand, requesting the picture, your spoken word cue is prompting them to echo you. Question 6. Which ethical principle requires RBTs to recommend the least restrictive procedures when possible, especially for decreasing challenging behavior? A. Beneficence. B. Non-maleficence. C. Autonomy. D. Justice. Answer B. Non-maleficence. This question asks about an ethical principle related to using interventions carefully. While using effective procedures, beneficence A is important. The principle of non-maleficence, do no harm, guides the selection of interventions, particularly those that might have risks, like punishment. It suggests starting with the least restrictive and intrusive procedures first, like reinforcement and extinction strategies, before considering more restrictive ones, like punishment or physical intervention, ensuring client safety and well-being. Autonomy is about choice. Justice is about fairness. Non-maleficence means minimizing potential harm by using the least intrusive effective methods. Question 7. A client usually throws toys when they want a specific toy other than the one they have. Throwing the toy results in getting the desired toy. The likely function of the throwing behavior is A. Attention. B. Escape. C. Access to tangibles. D. Automatic reinforcement. Answer C. Access to tangibles. This question describes a behavior maintained by obtaining a desired item. The antecedent is wanting a different toy. The behavior is throwing the current toy. The consequence is getting the desired toy. When a behavior is reinforced because it leads to gaining access to a specific item or activity, the function is access to tangibles/activities. Attention is getting social interaction. Escape is getting away from something. Automatic reinforcement is internal sensation. The behavior got them the desired toy. That's access. Question 8. When is it ethically required for an RBT to inform their supervisor about something they observed or did during a session? A. Only during scheduled supervision meetings. B. Only if it relates to a major behavior change. C. Whenever there is a potential safety concern, significant behavior change, a procedural question, or any event that deviates from the plan or policy. D. Only if the client's parent expresses concerns. Answer C. Whenever there is a potential safety concern, significant behavior change, a procedural question, or any event that deviates from the plan or policy. This question asks about the frequency and triggers for reporting to your supervisor, which is a critical ethical responsibility. You should proactively report anything that impacts the client's safety, welfare, or progress, as well as any procedural issues or deviations from the plan, as soon as possible. Waiting for scheduled meetings. A. Only reporting big changes. B. Or only reporting based on parent concerns. D. Is insufficient. Your supervisor needs current information to oversee the case effectively. When in doubt, report it out to your supervisor. Question 9. You are teaching a client a 5-step hand-washing routine using backward chaining. You provide full physical prompts for steps 1 to 4 and reinforce the client when they independently complete step 5. Drying hands. What is the immediate consequence that reinforces the client completing step 5 independently in this procedure? A. completing the entire hand-washing task. B. Access to a tangible reinforcer like a toy. C. Praise from the RBT. D. Any of the above as designed by the supervisor. Answer: D. Any of the above as designed by the supervisor. This question is tricky because it asks about the immediate consequence in backward chaining, while completing the entire chain is the ultimate outcome of mastering the last step. A. The reinforcer delivered by the RBT immediately after the client independently completes the last step is what directly strengthens that behavior. This reinforcer can be varied based on the client's preferences and the plan, including tangible items. B. Social praise. C. Or other agreed-upon rewards. The specific reinforcer is determined by the supervisor. The payoff for finishing the sequence comes right after the last step. Question 10. You are collecting data on a client's hitting behavior. You are using a data sheet where you make a tally mark for every time the behavior occurs. What dimension are you measuring, and what essential piece of information must you also include to calculate a rate? A. Duration, time of day. B. Frequency, duration of the observation period. C. Latency, setting. D. IRT, number of responses. Answer: B. Frequency, duration of the observation period. This question combines identifying a measurement method and what's needed to calculate rate. Making a tally mark for every occurrence is frequency, or count. To calculate a rate, frequency per unit of time, you need the total count and the total time you spent observing the behavior, which is the duration of the observation period. Time of day and setting are important for ABC or scatterplot data, but don't convert count to rate. IRT is time between responses, not needed for rate calculation. You need the count and how long you counted to get a rate. Question 11. If a client is reinforced for saying book when shown a picture of a book, but not reinforced for saying book when shown a picture of a car, this demonstrates A. Generalization. B. Shaping. C. Stimulus discrimination. D. Response differentiation. Answer: C. Stimulus discrimination. This question asks about learning to respond differently to different environmental cues. The client is learning to discriminate or tell the difference between the picture of a book, which signals saying book will be reinforced, and the picture of a car, which signals saying book will not be reinforced. Stimulus discrimination is responding differently in the presence of different stimuli. SDV is S delta. Generalization would be responding similarly to different types of book pictures. Shaping builds a single behavior. Response differentiation is reinforcing specific forms of a response. Learning which picture to label correctly is stimulus discrimination. Question 12. What is the ethical guideline regarding avoiding dual relationships? A. RBTs should avoid having both a professional and a personal relationship with clients or their families. B. RBTs should avoid working on both skill acquisition and behavior reduction goals with the same client. C. RBTs should avoid providing services in multiple settings, example, home and school. D. RBTs should avoid discussing clients with their supervisor. Answer: A. RBTs should avoid having both a professional and a personal relationship with clients or their families. This question defines an important ethical boundary. A dual relationship exists when you have both your professional role as an RBT and another type of relationship, like friend, family member, business partner, with the same client or their family. This can compromise your professional objectivity and boundaries. You should maintain a strictly professional relationship focused on the client's therapeutic needs. Working on different goals. B. Providing services in multiple settings. C. Or discussing with your supervisor. D. Are all typically part of the RBT role and not dual relationships. Keep your work life and personal life separate from clients. Question 13. You are collecting data on a behavior using whole interval recording with 3-minute intervals. You mark no for an interval. What does this indicate about the behavior during that interval? A. The behavior occurred at any point during the interval. B. The behavior did not occur at all during the interval. C. The behavior did not occur throughout the entire interval. D. The behavior occurred at the very end of the interval. Answer: C. The behavior did not occur throughout the entire interval. This question tests when you mark no for whole interval recording. With whole interval recording, you mark yes only if the behavior occurs continuously for the entire duration of the interval. Therefore, marking no means that the behavior did not occur continuously throughout the entire interval. It might have occurred for a part of the interval, but it wasn't happening for the whole 3 minutes. Partial interval marks yes if it occurs at any point. A. Momentary time sampling checks the end. D. Did not occur at all. B. Would also result in a no, but the rule for no is broader. It just wasn't throughout. If the behavior wasn't happening the whole time, it's a no for whole interval. Question 14. A client is working on an imitation program. You say, do this and clap your hands. The client claps their hands. The instruction do this paired with your clapping action functions as A. Conditioned reinforcer. B. Discriminative stimulus, SD. C. Motivating operation, MO. D. Stelta, S. Answer: B. Discriminative stimulus, SD. This question asks you to identify the antecedent that sets the occasion for a specific behavior to be reinforced. In this imitation trial, the instruction do this plus your model, clapping, together form the antecedent stimulus, SD, that signals that if the client claps, reinforcement is available. A conditioned reinforcer strengthens behavior when delivered after it, and MO affects motivation. In Stelta signals reinforcement is not available. That est is the cue that tells the client to respond now. Question 15. When implementing an extinction procedure for a behavior, you should A. Provide an aversive consequence immediately after the behavior. B. Remove a desirable consequence immediately after the behavior. C. Withhold the reinforcement that was previously maintaining the behavior. D. Reinforce an incompatible behavior. Answer: C. Withhold the reinforcement that was previously maintaining the behavior. This question asks for the definition of extinction. Extinction is the procedure of discontinuing the reinforcement that has been maintaining a behavior, resulting in a decrease in the behavior over time. Options A and B describe punishment procedures. Option describes differential reinforcement, which is often used alongside extinction, but it is not the definition of extinction itself. Extinction is simply stopping the payoff that was making the behavior happen. Question 16. You are teaching a client to wash their hands. You present the steps of the task analysis in order, prompting as needed, and reinforce the client upon completing the entire sequence correctly. What chaining procedure are you using? A. Forward chaining. B. Backward chaining. C. Total task chaining. D. Shaping. Answer: C. Total task chaining. This question describes teaching a multi-step skill, task analysis, by working through the entire sequence in each trial. The key is that you are presenting all steps of the task analysis from beginning to end, completing the entire sequence in each teaching opportunity with reinforcement after the whole task is completed. This is total task chaining. Forward chaining teaches from the beginning steps forward. Backward chaining teaches from the last steps backward. Shaping builds a single behavior gradually. When you practice the whole sequence every time, it's total task. Question 17. What is the purpose of thinning a reinforcement schedule after a behavior is well established? A. To make the client dependent on constant reinforcement. B. To make the behavior less durable and easier to extinguish. C. To maintain the behavior with less frequent reinforcement and make it more resistant to extinction. D. To transition to using only natural reinforcers. Answer: C. to maintain the behavior with less frequent reinforcement and make it more resistant to extinction. This question asks why we thin reinforcement after learning. Thinning means moving from reinforcing a behavior often, like CRF, to reinforcing it less often, intermittent schedules. This strengthens the behavior, making it more likely to continue even when reinforcement is not always available. It makes the behavior more durable and resistant to extinction. It does the opposite of making them dependent, A, or fragile, B. While transitioning to natural reinforcers, D, is often a goal. Thinning is the process of adjusting the schedule, not necessarily the type of reinforcer, although they are related. Thinning helps the behavior last longer with less frequent rewards. Question 18. When should an RBT document their session notes and data? A, only if there were challenging behaviors. B, at the end of the week for all sessions. C, promptly after each session, according to company policy. D, only when the supervisor specifically requests it. Answer: C, promptly after each session, according to company policy. This question is about timely and accurate documentation. Session notes and data should be completed as soon as possible after the session ends while the information is fresh. This ensures accuracy and provides the supervisor with current data for monitoring progress and making decisions. Waiting too long, B, or only documenting sometimes, D, compromises the reliability and usefulness of the data. Follow your company's specific policy, but the principle is to document right away. Question 19. If a client engages in a behavior that is maintained by the sensory feedback, it produces example flapping hands because it feels stimulating. The function is likely: A, attention; B, escape; C, access to tangibles; D, automatic reinforcement. Answer: D, automatic reinforcement. This question asks you to identify the function when external consequences aren't the primary driver. Behaviors maintained by the internal sensations or sensory input they produce, without depending on external social interaction or getting away from items/tasks, are maintained by automatic reinforcement. Flapping hands, rocking, or repeating sounds can be examples of automatic behaviors. If the reinforcement comes from within the person doing the behavior, it's automatic. Question 20. What is the most ethical way for an RBT to handle a situation where a client's behavior escalates to a crisis, posing immediate serious harm, and the RBT has been trained in specific physical intervention procedures for this client? A, use the physical intervention immediately, without considering other options. B, use the physical intervention only if absolutely necessary to prevent immediate serious harm and exactly as trained in the crisis plan, while simultaneously seeking assistance from supervisor/others. C, try to de-escalate verbally for a long period before using physical intervention. D, avoid physical intervention at all costs, even if harm is imminent. Answer: B, use the physical intervention only if absolutely necessary to prevent immediate serious harm and exactly as trained in the crisis plan, while simultaneously seeking assistance from supervisor/others. This question addresses the ethical and practical use of trained physical intervention in a crisis. Physical intervention is a restrictive procedure and should be used only as a last resort for safety, preventing immediate serious harm when less restrictive means are insufficient. It must be used exactly as trained in the individualized crisis plan for that client and paired with seeking additional help from supervisor, colleagues, or emergency services. It's not used automatically. A, delaying too long might risk injury. C, and avoiding it entirely even when trained and necessary for safety is also inappropriate. D, it's a safety tool for immediate serious danger, used only as trained and with support. Question 21. When creating a behavioral definition, it should be: A, subjective and reflect the client's feelings. B, objective, clear, and measurable. C, based on the presumed function of the behavior. D, easily understood by someone with no ABA training. Answer B. Objective, clear, and measurable. This question asks about the characteristics of a good behavioral definition. A definition must be objective, describing observable actions, clear, unambiguous, and measurable. You can count or time it. This ensures that different observers can collect data reliably and consistently. Subjective terms, A, are avoided. Function, C, is the why, not the definition itself. While clarity is good, it must first and foremost be objective and measurable, which may require some explanation for someone new to ABA. D, describe what you see and hear so anyone can measure it. Question 22. What is the purpose of a motivating operation, MO? A, to signal that reinforcement is available for a specific behavior, SD. B, to decrease the future likelihood of a behavior. C, to change the effectiveness of a reinforcer and influence the frequency of behaviors that have led to that reinforcer in the past. D, to provide reinforcement after a behavior occurs. Answer. C, to change the effectiveness of a reinforcer and influence the frequency of behaviors that have led to that reinforcer in the past. This question asks about the function of a motivating operation, MO. MOs, like being hungry or tired, change how much you want a particular reinforcer. They make it more or less effective and influence how likely you are to perform behaviors that got you that reinforcer before. And nest, A, signals reinforcement is available if you respond now. Punishment decreases behavior, B. Reinforcement happens after behavior, D. Memos alter motivation and the value of rewards. Memos make you want the prize more or less. Question 23. If you are tracking data on a client's transitions between activities, measuring the time from when you say clean up time until the client puts the first toy in the box, you are measuring A, duration, B, frequency, C, latency, D, interresponse time, IRT. Answer C, latency. This question asks about a specific time-based measurement. The phrase time from when you say to until the client picks up the first toy, start of behavior, measures the time between the presentation of a stimulus, the instruction, and the initiation or start of the target behavior, picking up the toy to clean up. This is the definition of latency. Duration measures how long the cleaning lasts. Frequency counts occurrences. IRT is time between picking up toys. Latency is the delay between the instruction and the start of the response. Question 24. When teaching a complex skill using a task analysis, reinforcing the completion of the entire sequence or the steps being worked on in that trial is characteristic of A, shaping, B, chaining procedures, C, discrete trial training, D, differential reinforcement. Answer B, chaining procedures. This question asks about the general approach to reinforcing multi-step skills taught via task analysis. Chaining procedures, forward, backward, total task, all involve breaking a skill into steps and reinforcing the completion of the learned sequence, the entire chain or the part of the chain being taught in that trial. Shaping builds a single behavior. DTT teaches skills in discrete trials. Differential reinforcement reinforces one behavior while not reinforcing another. Reinforcing the completion of a sequence of steps is a core part of chaining. Question 25. What type of verbal behavior is occurring when a client says car after hearing a car drive by when no car is visible? A, manned, B, tact, C, etroic, D, intraverbal. Answer B, tact. This question asks about a specific type of verbal behavior based on the antecedent. The antecedent is a non-verbal stimulus perceived through hearing, the sound of a car. The behavior is saying the corresponding label, car. When a verbal response is evoked by a non-verbal stimulus in the environment, heard, seen, smelled, etc., and reinforced by generalized conditioned reinforcement, like praise, it is attacked, mand is requesting, evoked by an MO. Echoic is repeating something heard. Intraverbal is a verbal response to another verbal stimulus. Hearing the sound and labeling it as attacked. Question 26. An RBT notices that their data for a client's hitting behavior is much lower than what the parent reported occurring over the weekend. What is the most appropriate action? A. Assume the parent is exaggerating and continue collecting data as usual. B. Discuss the discrepancy with the parent and try to clarify their definition of hitting. C. Inform your supervisor about the discrepancy and discuss potential reasons for the difference in data. D. Change your definition of hitting to match what the parent describes. Answer C. Inform your supervisor about the discrepancy and discuss potential reasons for the difference in data. This question addresses discrepancies in data and reporting to your supervisor. It's common for behavior to differ across settings. Therapy viz, home, and observers. However, a significant discrepancy warrants discussion with your supervisor. They can help determine if the definition is inconsistent, if the environment is different, if the RBT is missing instances, or if the parent's report isn't objective. Changing your definition, D, or assuming exaggeration, A, are inappropriate. Discussing with the parent, B, is okay, but involving the supervisor is crucial for clinical oversight and troubleshooting data issues. Your supervisor is responsible for ensuring data accuracy and understanding differences. Question 27. What is the ethical responsibility of the RBT if a client's behavior suddenly escalates to a level posing immediate risk of serious harm, and the RBT has not been trained in physical intervention for this client? A. Attempt a physical restraint based on general training. B. Use verbal de-escalation only. C. Use trained safety procedures, example blocking, moving, if possible, prioritize safety, and contact your supervisor and / or emergency services immediately. D. Document the incident and wait for supervisor feedback during the next meeting. Answer C. Use trained safety procedures, example blocking, moving, if possible, prioritize safety, and contact your supervisor and / or emergency services immediately. This question is a critical safety scenario when you lack specific restraint training. If a behavior poses immediate serious harm and you are not trained in physical intervention for this client, your priority is still safety using any general safety procedures you are trained in, like blocking access to danger, moving the client or yourself out of the way, and immediately escalating the situation by contacting your supervisor and / or emergency services, like 911, as necessary and according to company policy. Attempting untrained restraint, A, is unsafe and unethical. Relying only on de-escalation, B, might not be sufficient in a crisis. Waiting to report, D, delays necessary support. Safety first, get help, and report immediately. Question 28. What is the ethical principle that relates to being qualified and trained to perform the tasks required of an RBT? A. Integrity. B. Fidelity. C. Competence. D. Beneficence. Answer C. Competence. This question asks about an ethical principle related to skills and training. The principle of competence requires behavior analysts and RBTs to provide services only within their scope of training and expertise. This means you must have received appropriate training and supervision for all procedures and populations you work with. Integrity is honesty, fidelity is trustworthiness, beneficence is doing good. Your ability to perform your job safely and effectively comes from your competence. Question 29. When using reinforcement, varying the types of reinforcers used with a client is important to A. Make data collection easier. B. Prevent satiation and maintain the reinforcer's effectiveness. C. Reduce the overall cost of reinforcement. D. Make the client less likely to engage in challenging behavior. Answer. B. Prevent satiation and maintain the reinforcer's effectiveness. This question asks about the practical importance of using a variety of reinforcers. Using a variety of items, activities, or social interactions as rewards helps prevent the client from getting tired of or satiated on just one or two preferred items. This helps keep motivation levels high and ensures you have a range of effective motivators available to use. It's not primarily for data collection ease, A, cost reduction, C, or directly reducing challenging behavior, D. Although it can contribute to a positive environment, keep the reinforcement menu fresh to keep them motivated. Question 30. What is the primary ethical guideline regarding modifying a client's behavior intervention plan, BIP? A. RBTs can make minor modifications to the BIP as needed based on session observations. B. RBTs must obtain written permission from the client's family before any modifications are made. C. Only a supervising BCBA or BCABA is authorized to modify a client's BIP. D. RBTs can modify the BIP if they document the changes in their session notes. Answer: C. Only a supervising BCBA or BCABA is authorized to modify a client's BIP. This question reinforces the RBT's scope of practice regarding treatment plans. RBTs are implementers. They do not design or modify behavior intervention plans. Any changes to the BIP must be made, approved, and typically trained on by the supervising BCBA or PCABA, who has the expertise to make clinical decisions. RBTs do not have the authority to make changes themselves. D. Even with family input. B. Though family input informs the supervisor's decision. Your supervisor is the only one who can change the plan. Question 31. You are teaching a client to identify colors. You hold up a red card and say, "Touch red." The client touches the red card. You also present a blue card sometimes, and if the client touches the blue card when you say, "Touch red," you do not reinforce them. What is the blue card functioning as in this scenario? A. Discriminative stimulus, SD. B. Motivating operation, MO. C. Stelta, S. D. Conditioned stimulus, CS. Answer: C. Stelta, S. This question asks you to identify a specific type of antecedent stimulus used in discrimination training. The instruction "touch red" paired with the red card is the discriminative stimulus, SD, because it signals that responding to the red card will be reinforced. The blue card is the Stelta, S, because it is a similar stimulus present in the environment, but responding to it when the instruction is "touch red" is not reinforced. The Stelta signals that reinforcement is not available for that specific response in its presence. An MO affects motivation. A CS is used in classical conditioning. The Stelta tells you, "Don't do it now." Question 32. What does the term establishing operation, EO, refer to? A. A stimulus that signals reinforcement is available. B. A consequence that increases behavior. C. An environmental event that increases the effectiveness of a reinforcer and increases the frequency of behavior that has been reinforced by that reinforcer. D. A consequence that decreases behavior. Answer: C. An environmental event that increases the effectiveness of a reinforcer and increases the frequency of behavior that has been reinforced by that reinforcer. This question asks for the definition of an establishing operation, EO, a type of motivating operation, MO. An EO is an antecedent stimulus or condition, like deprivation of food or water, that makes a reinforcer more valuable, increases its effectiveness, and makes behaviors that have led to that reinforcer in the past more likely to occur. An abolishing operation does the opposite. The EO makes you want the reward more. An EST signals when the reward is available, A. Reinforcement, B. And punishment, D. Are consequences. EOs change motivation. Question 33. When conducting a preference assessment using a multiple stimulus without replacement, MS-DOGO method, how is the procedure conducted? A. Items are presented one at a time, and the RBT measures engagement time. B. Multiple items are presented, and when an item is chosen, it is removed from the array for subsequent trials. C. Items are presented in pairs, and the client chooses one from each pair. D. The client is allowed to interact with multiple items freely, and the RBT observes which items are approached and engaged with. Answer B. Multiple items are presented, and when an item is chosen, it is removed from the array for subsequent trials. This question asks about the procedure for a specific preference assessment. In an MSWO, multiple items are presented simultaneously. When the client chooses one, they get brief access, and then that chosen item is removed from the selection set for all future trials in that assessment. This forces choices from the remaining items and helps establish a preference hierarchy. Single stimulus is A. Paired stimulus is C. Free operand is T. MSWO removes the chosen item from the choices. Question 34. Which ethical principle requires RBTs to be truthful and accurate in their documentation and communication? A. Autonomy. B. Justice. C. Beneficence. D. Integrity. Answer D. Integrity. This question asks about an ethical principle related to honesty and accuracy. Integrity means acting truthfully, honestly, and accurately in all professional activities, including recording data, writing notes, and communicating with supervisors and team members. Autonomy is about choice, justice is fairness, and beneficence is doing good. Being truthful and accurate is about maintaining your professional integrity. Question 35. What is the main ethical consideration when selecting target behaviors for intervention? A. That the behavior is easy to measure. B. That the behavior is a skill the RBT enjoys teaching. C. That the behavior is socially significant and will benefit the client's life. D. That the behavior can be quickly reduced or increased for rapid results. Answer C. That the behavior is socially significant and will benefit the client's life. This question reinforces the ethical principle of focusing on socially significant behaviors. AIDBA aims to improve lives. Therefore, target behaviors should be chosen based on their importance to the client and their community, focusing on skills that enhance independence, safety, social interaction, and overall quality of life. Ease of measurement. A. RBT preference. B. Or speed of change. D. Are not the primary ethical considerations. Choose goals that make a real, positive difference in the client's life.